Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Hey guys, thanks for being listeners to the show. Go to dentalimplantpractices.com and find all of our resources. Also find us on Facebook, Dental Implant Practices page on Facebook, and go to iTunes and leave me a review on iTunes so we can help spread the message. Thanks. Welcome back to another episode of the Dental Implant Practices podcast. I'm your host, Philip Gordon, and today it's a huge honor for me to introduce Dr. Samuel Lee. Sam, thanks for being on the show with me today.
Oh, it's my honor to be in your show.
Well, I know you've done quite a bit in your career, and I'll do a little introduction for people that may not know you. You hold 2 doctoral degrees in dentistry, Doctor of Medical Science from Harvard, and Doctor of Dental Surgery from UCLA. You hold a specialty certificate in Periodontology from Harvard. You devote your time to helping underserved population to have access to dental care through your nonprofit organization named Care to Share Smile. You are an innovator with your passion for teaching and developing new techniques. When you were a dental student, you taught biochemistry at UCLA. Today, you teach across the globe to dental schools and make time to conduct CE courses for general dentists and specialists while increasing access to care to underserved populations in developing countries. You're a diplomat of the International Academy of Dental Implantology and actively conducts research and development while running a busy private practice in Boston and San Diego. Your practices are limited to orthodontics and implant surgery. Congratulations with all that you've done here. I know you've got quite a bit going on. You've invented the Crestal window sinus grafting technique. You own the patent on various sinus and surgical instruments, and you've got a lot of things going on. So you've got quite a decorated past here and have a lot to offer as far as talking about dental implants. So thanks for joining me today.
Thank you. Thank you for a kind introduction.
So I'd like to pick up and kind of talk about some of the things that your pathway into dentistry and your pathway into private practice, and then kind of your pathway into your passion for implant dentistry. So why don't you kind of walk people through how you kind of came to be a dentist and how that got into be a practice owner and then the implantology?
Oh, fantastic. So just like every other dentist, when we interview for dental school, we say we want to help people and we are good with our hands, so we want to go to dental school to become a dentist. For me, I wasn't sure what dentistry was because my parents were not dentists, and I was the only one in dental school. But right after I graduated, I met the right mentor. I worked for this guy named Dr. Michael Kwan in Los Angeles, and we did over 1,000 implants a year. So I got to learn a lot from him, and I got into a lot of exposure in implantology. After working for him for several years, I decided to pursue my perio degree at Harvard, and ever since then, I've been just focusing on sharing my knowledge, because as a general dentist, when I was general dentist, doing implants was very difficult because not many specialists wants to share what they know to general dentists for political reasons. But I wanted to share everything I know. What specialists know should also be given to general dentists. As you know, some general dentists are as good as many specialists. So that's my goal in my life, to educate as many general dentists as possible so that more people can benefit from this wonderful field of implantology. And what we do is we also have a nonprofit organization called the Care to Share Smile, and our mission is to help as many poor patients as possible. So we go to Dominican Republic, Mexico, China, Chile to conduct implant program where we do implants for free, and many patients have benefited from our program where we teach the dentist at the same time we provide the free implant surgery.
That's really great that you're able to be so busy but also give back like that.
Thank you. And right now, because of guided surgery and many other new technology, I am very excited to be a dentist today in 2017. Before, when we did it was all about putting the implant where the bone is. And then we switched to an era when we decided to put the implants where the prosthesis go by doing a bone grafting. However, when I first started doing implantology, it was all about block bone and GBR. But now in 2017, we have a better technique, a minimally invasive technique where all the bone graft is done through a very small hole, through a tunnel. And even sinus lift is done in very predictable manner in just few seconds. So I'm very happy to share all this new technology.
Yeah, for someone who's not doing those types of procedures, are you able to kind of talk about that sinus lift technique? Is that something you can even cover in a conversation with a podcast?
Sure. So I invented this technique called Crestal window technique in 2008. And we came out with a series of instruments to be able to lift the sinus through the crest. It's a very unique technique where it's not a blind technique and it's less traumatic for the patient. But in 2017, 9 years later, this technique is good, but I have modified the technique even better, where we use the hydraulic pressure as we are drilling to prevent the sinus. So the technique has been simplified furthermore 9 years later, and anyone is now able to lift the sinus predictably in less than 5 seconds.
What type of steps are you going through that? Are you making surgical guides for that? Are you doing? Are you kind of breaking bone, or are you kind of doing a bump with bone grafting material, or how are you able to do such an easy sinus lift?
The best, pressure equals force divided by area. So in order to minimize pressure to Schneiderian membrane, you can do two things. You can minimize the force, or you can maximize the surface area. The idea is to maximize the surface area and minimize the force. So by having a stopper, you minimize the force, but by introducing a putty bone inside the sinus, we maximize the surface contact, and the bird that we design maximizes the surface area in order to prevent perforation of the Schneiderian membrane. So there is a kit available in our website. Our website is www.ce4dentist.com. It stands for Continuing Education for Dentists.com. And if you go there, anyone can watch the lecture about this new techniques in our website.
And then is it also possible to buy the kit from there, or is that something they can buy elsewhere?
They could buy it from elsewhere, or they can buy directly from the website just by replying after watching the educational video. They could purchase directly from the website.
Oh, great. And what's the name of that video called? Where do they find that on that website?
I think the latest video we have is New Techniques and in 2017. So that is the latest update.
Excellent. Yeah. Fantastic.
Everything we do in 2017 is very different from what we've done in 2016, even 2015. Every year, every month, we have new techniques, new technology, and that's why I think it's an exciting time to be dentist.
Yeah, absolutely. I mean, I think we've got more opportunities now than any other generation of dentist ever has, and a lot of that is based on the science that we know and the technology development that we've had. And, we've definitely got it better than generations before us as far as things we're able to do with the predictability that we're able to do this with.
Yes. We're very lucky to be dentists. And also, bone grafting for vertical or horizontal ridge augmentation was very challenging until we developed a modified tunneling technique. In the past, people have been trying to do a tunneling technique to do ridge augmentation, but it was very unpredictable. Sometimes we grow bone, sometimes we get nothing. And we were able to find out common denominator that leads to successful tunneling bone grafting technique. Now, by doing tunneling bone grafting technique, this dramatically increases the chances of success because you don't have to suture the flap. You don't have to open the flap, first of all, and you don't have to suture at the end. And the results that we gain are incredible. I think the secret to tunneling technique was to immobilize the graft material. And we have this unique technique where we release the flap to extend the flap and to cut the muscle fiber internally inside the flap, inside the tunnels, so that muscle doesn't pull after the tunnel. And we have this unique suturing technique so that it stabilizes the tunneling graft that we put in. So that has been a huge change in my practice. And many of your attendees can log into our website in order to view this technique in order to help their patients.
So is that to increase ridge thickness then? Is that what you're referring to?
Yes.
Yeah. So is that more on the maxilla or mandible that you are successful with these or both?
Oh, it works everywhere.
Yeah, excellent.
Except the lingual or palatal side, but
sure.
Usually 99% of deficiencies are on the buccal.
Yeah, correct. Yeah. So what other kind of new techniques or disciplines or technologies are you excited about and lecturing on, or have people lecturing on your website?
Yeah, so when we were doing conventional implant osteotomy, we used to use a lot of water, irrigation with saline, and multiple drilling steps were recommended to reduce the heat for the bone. However, that concept is also very old. In 2017, we only use one burr for any implant size. That has been possible because of a unique burr shape that decreases the heat during the osteotomy. So we don't use any water. During the osteotomy, we collect tons of bone and just one burr to finish any implant osteotomy, any size, even 5.0, 6.0 wide diameter implant. Therefore, the implant surgery is very quick, easy. Even full mouth implants can be done in less than 20 minutes because it's just one burr. Especially with computer-guided surgery, this becomes a very predictable and very easy procedure for the patient and also for the clinician. So that's also a very unique feature that we teach in our academy. We believe that we have to introduce new concepts and new ideas each month. Otherwise, we should retire. So this has been a very exciting moment in my life. And we also teach orthodontics in our academy because without knowing how to move teeth, we cannot be a very good implantologist. And we also branched out by offering full 1-year orthodontic course. A unique thing about being an implantologist and also offering orthodontic service is that there's no limit in terms of where we can move the teeth. When we incorporate orthodontic implants called pads, temporary anchorage device, we can not only intrude the teeth, extrude the teeth, but we can move the whole arch of the dentition towards distal. So we can distalize not only one or two teeth, but we can distalize the whole maxilla or whole mandible. And it has been a very, very powerful tool in orthodontic treatment.
Yeah. So when you can control the teeth and control the bone, and then use implants, your treatment possibilities are endless. And I think that's kind of maybe why you're seeing such a good correlation with that. Is that what you're getting at? Absolutely. Yeah. So your organization, the International Academy of Dental Implantology, what sort of benefits do they offer implantologists or specialists or general dentists? What sort of training or courses or accreditations are there available with that? So we offer CE credits for all the dentists. We are a California board approved CE provider, and also AGD-approved CE provider. One thing that is very unique to our academy is that we always have new techniques. We always have the latest technique that most people don't know, and that is the most powerful feature of our academy. And the members of our academy are down to earth, willing to learn, willing to share. We have many faculties in our academy, and they're very approachable and very humble people. So please join our academy. Every second week of February, we have annual meeting of our members in San Diego, and we offer fellowship program or Diplomate status by giving oral examination and also written examination and submission of 10 cases. And by doing this, anybody who wants to prove to public that they are certified by an international academy can receive a fellowship or diplomate or mastership in our academy. So anybody is open to apply.
but they have to go through these 3 steps of verification of examination, which is a very good learning experience for any dentist who wants to further their study in implantology. Also, we have nonprofit charity dentistry every month in different part of the world. If any dentist wants to come and help out and give their time, we're always open to help having new members. If you go to facebook.com/IADI USA, you will see our latest activities that we do with our members. It's a really good feeling to be able to help many underserved people. As we mentioned earlier, we have 1-year orthodontic course where it's a very unique and very powerful orthodontic course. A lot of people talk about 6-month smile, but this is way beyond a 6-month smile. Where you fix the overbite overjet and also intrude and correct the occlusal cant, distalize the whole maxilla in class 2 cases. Even in surgical class 3 cases, we're able to close the open bite and move the lower incisors back with orthodontic implants. So very, very powerful orthodontic course that we can offer to general dentists. And finally, we have a course where you're able to place implants on live patient. We have a 5-day super intensive mini residency in implantology where the attendees place about 20 implants in 5 days. Not only implants, but vertical ridge augmentation, horizontal ridge augmentation, sinus lift technique, and guided surgery.
Excellent. Yeah, that sounds like some real world experience right there. And I think that's what people are wanting. They're not just wanting a just CE anymore. They're wanting something that they get that real world experience and the the ability to take it home and integrate those learning experiences into their practice.
Yeah, because of internet and many knowledge floating around, now general dentists have so many opportunities to learn. I think that is great. We need to have more super general dentists. That's what we need in United States, because United States, we are so specialty driven that many patients have to be referred out. It can be very inconvenient. However, if one general dentist has the knowledge of orthodontics and implantology, we are able to really offer fully integrated, comprehensive treatment to the patient, and many patients can benefit from their services.
Yeah, absolutely. I mean, I think sometimes too much is made about, this procedure has to be done by a specialist and that procedure has to be done by a specialist. I think, with the right training and the right knowledge and the right tools that, anybody with the learning, the love for dentistry, can do these techniques. It's just, sometimes it's about where to go for that guidance. And so it's great that you guys are offering, multiple avenues of learning and multiple, aspects, not just the implants, but then the orthodontist as well.
Yeah. Finally, I forgot to mention, we also have an IV sedation course. This is to get an IV sedation license in America. So that's also another very important course that we offer annually in February.
Yeah, those, licenses for those, regionally vary state by state, but I know, you've got to get training for them either way, and you've got to stay up current with that. So it's good to offer that because, some of these larger cases are definitely going to want, that sedation offer.
Absolutely. Sedation is a very important part of our practice to be able to deliver extensive treatment.
Now, you're practicing in Boston and in San Diego. Is that correct?
Yes. Right now, I'm in Boston.
Okay.
Boston is a very nice place to practice. Many patients are very well educated, and it's a wonderful place to be. However, winters are very brutal. So, I live in San Diego for the winter.
That it's nice to be able to have that opportunity to do that because the Midwest and the Northeast winters can be pretty tough, and I know nothing beats that California weather. So it's good to have that opportunity. Do you have associates or people covering your practices at various times when you're out teaching and lecturing in different parts of the country?
We have many residents in our practice. They do 2-year rotation. It's open to any international dentist who wants to come and learn, as well as American dentists. So they take care of most emergencies that their there are when I'm not there. However, because my practice is referral based, I have the luxury of leaving my practice for a while when I go to different places.
Sure. Yeah, it's nice to be able to have that kind of scheduling comfort and say, if I'm only seeing upon referral, then I can, schedule accordingly and have that, not be an issue. So what technologies would you say are important for someone to wanting to get into this type of dentistry, as far as you're talking sinus lifts and, ridge splits? Are you doing any ridge splitting these days? Or are you doing much with the piezoelectric? Are you doing everything with a handpiece? Or, we haven't talked about anything as far as these special instruments you've got to do these procedures with.
I haven't touched piezo for a long time because just last year we've been doing a lot of ridge splitting. However, tunneling has been so predictable now. Everything has been done through tunnel, whether it's bone graft or gum graft. I think tunneling is the way to go.
So you're doing less ridge splits and just building up that buccal wall defect, and then coming back and placing your implants after that bone has strengthened. Is that correct?
Correct.
Okay. Yeah. So that may limit the amount of other techniques that you use.
Yeah, the best approach in 2017 is minimally invasive tunneling technique. It's called MIT technique. It's a modified tunneling technique that is very predictable and is very easy to learn, and there's no need to split ridges anymore.
Now, with that, is there still a membrane that you're using with those? Obviously you're placing bone in there, and then are you not opening up the are you not having to increase bleeding, and how are you getting the membranes in there? Can you elaborate on that just a bit?
Yes, use of membrane is very critical in using my technique. And what we do is we fold the membrane like a cigarette, and once we put it in, we expand them inside the tunnel. And in terms of decortication, it's impossible to do decortication inside the tunnel. So we have a special instrument designed to do decortication inside the tunnel.
Okay, so you're just taking the same tried and true methods and just have a new way to do it through the tunnel, which increases stability and increases predictability. So it's not that you're changing the major principles, you're just changing the approach on how to do it.
Yes, tunneling has been developed in 1960 from various clinicians. So it's not a new thing, but once again, it has not been predictable. However, with the new innovative instruments that we develop, anybody now can do tunneling in predictable manner.
Yeah, that's great. So what would be your favorite procedure that you do nowadays? Is, you like to do implants and you like to do the orthodontics. What's something that really gets you excited these days? Is it these new procedures you've got? Is it the tunneling techniques? Is it what do you really enjoy doing in your practice?
My favorite procedure would be sinus lift.
Sinus lift, okay.
Yeah, sinus lift is the most exciting because the membrane is very thin and it's very technique sensitive. So I love doing sinus lifts for that reason. It's very exciting to be able to see the snug area membrane moving up and down.
As far as education, you guys have that listed on your site. Is all the education that you do, is that all taught in San Diego, or is that offered throughout different places? We
offer education throughout the United States, usually mostly in New England area, and also in San Diego. 80% is done in San Diego. We have a nice facility in San Diego, and if you have a family, San Diego is a great vacation place. Also, we have a university in Dominican Republic that we partner with, and we offer a lot of charity work and also live surgical course in Dominican Republic as well. Gotcha. And does that one in Dominican Republic, does that offer multiple surgical techniques? That's not just implant placement, or is that grafting, advanced grafting, and all of your services there? It's individually catered. So if a doctor says, I'm an oral surgeon and I'm not interested in placing implants, I want to learn your tunneling technique, then we would just line up tunneling procedures for the doctor. In contrast, if the doctor says, I never place an implant, I would like to place as many implants as possible, then we will line up as many simple implant cases as possible. So it's individually catered, and it's open to anybody who's willing to expand their knowledge.
Excellent. That's great how you can really be selective with someone, because people come in with different levels of experience, and they're looking for something different out of each one of these courses. So it's good that you're able to tailor and meet that where people's specific needs are. Now, is there anything that you feel like we haven't covered tonight that you would want people to know, either about your academy or teaching or any of the systems you're working on? I mean, where do you feel like is a good place for people to start if they want to kind of learn more about you and the things that you have to offer?
I think they should visit our Facebook, and also they should visit our website, watch our videos, and just exciting time to be a dentist in 2017. Don't think that we know everything. We have to be open-minded. We have to be lateral thinkers so that we can help more patients.
I think it's a culmination of knowledge, and everyone's got something to learn, and hopefully everybody's got everything to share too. So you think starting at the website ce4dentist.com, and you also think so would coming to the seminar or the annual course in February, be a good place to start, or watch some of the videos and maybe go to one of your educational programs?
Yeah, watch the videos we have online. I think that is the best place to start. Most of the knowledge can be delivered through internet nowadays. After you watch the video, if you want to wet your fingers and learn more in detail, then come to our live surgical course where we learn by doing.
Sure. Do you have to sign into do you have to become a membership for the website, or are all those videos kind of free to share?
About 3% is open to public. 97% you have to be a member, but you can start with the 3%.
Sure, absolutely. Yeah, good place to start there. And then becoming a member gets you access to the videos and probably lots of other great opportunities to learn as well. Is that right?
Absolutely, that is correct.
Well, excellent. Dr. Lee, I really appreciate your time here. I will add links to the podcast here for people to reach out and get in touch with the IADI, the International Academy of Dental Implantology, so that they can learn more about you and the great things that you're doing. So I really appreciate your time. Look forward to learning more from you in the future, and hopefully maybe seeing you at one of your surgical courses.
Thank you, Dr. Gordon. It was my pleasure talking to your group.
Okay, thank you so much.
Thank you. Have a great day.
Bye-bye.